right, thank you very much. Let's see how am I doing this? Clicking wise? Sorry. Oh, here we go. Got it. Okay, so thank you guys very much. So this is your regulatory and health policy session, and we had two major objectives. One was to really focus on issues of data sharing and privacy and security, and the other is to talk about emerging regulations. So I'm going to let the real lawyer talk about emerging regulations, and I'm going to focus on issues of data sharing and privacy and security and touch a little bit on the law. So this is Sally. Right? So Sally's super interested in finding out a little bit more about herself and a little bit more about her family. So she goes online and she orders her favorite direct-to-consumer genetic tests. She gets it in the mail and she sends a saliva sample in through the mail. And a couple weeks later goes on the internet and finds out a whole bunch of information that she's been wanting to know. So information about her genetic predisposition to certain traits and diseases, her ancestry, and she finds out that she has a second cousin that she never knew existed, right? So how are we protecting Sally's privacy when she engages in this particular activity? Well, the main way that Sally's privacy is protected is hopefully when she bought that direct-to-consumer genetic test, she read through the terms of service that come with it. And hopefully in those terms of service, it very clearly outlined for her, right, in big print, what their privacy protections were and who might get access to her information and her data and how her information would be protected. And if the company that Sally used to do this consumer genetic testing violates their own terms of service, then there could be some consequences for them. So they may get cited by the Federal Trade Commission for unlawful trade practices. They may have fines against them. Sally could sue them potentially if she suffers damages from that activity. But there's other ways in which Sally's information that has been generated as part of this transaction might also be at risk and her privacy might be compromised. And that is through data sharing in various ways. So with whom might Sally's data be shared when she engages in this direct-to-consumer genetic testing activity? So I'm going to talk about three groups or three people who might have access to Sally's data. The first are researchers. So she may have agreed when she signed up for that direct-to-consumer genetic test to allow the company that she was signing up with to use her genetic information or whatever information they collected from her for research and to share it with additional researchers, whether in aggregate form or in de-identified individual form. Sally may also download her information and bring it into her physician, as we heard in our last panel, and might say, you know, help me understand what this means, or I want to do some follow-up testing on this, I want to get this confirmed. And so she's bringing it into the healthcare system and sharing it voluntarily with the healthcare system. And finally, other actors like law enforcement might actually go in and be able to access Sally's information and use it for a variety of other purposes. So I'm going to focus a little bit on the privacy risks associated with each of these groups having access to Sally's genetic information and other information through direct-to-consumer genetic testing, tell you a little bit about the laws that are currently in place to protect in each of these areas. I'm going to focus most of my time on this last category of law enforcement because it is one of the hotter issues right now, and there's more legal uncertainty in this space. So let's start with research and healthcare and access to information when it is shared in one way or another with researchers and healthcare institutions or healthcare providers from direct-to-consumer genetic testing companies or from the consumers of direct-to-consumer genetic testing. So there's two ways that we can protect privacy in this realm. One way is we can prevent people from getting access to the information that we don't want them to have access to. So that's at the front end saying, we're going to prevent certain groups or certain people from getting access to certain types of information without our specific authorization. In healthcare, the main way that we do that is through our favorite law, HIPAA, the Health Insurance Portability and Accountability Act. And HIPAA protects the unauthorized disclosure of protected health information by covered entities. So what's really important about HIPAA is that it only applies to covered entities. So a lot of direct-to-consumer genetic testing companies themselves may not be covered entities, but to the extent to which that information is shared with healthcare providers and many researchers, they may be part of covered entities and they wouldn't be able to then go on and release that information, if it's protected health information, to other third parties without the individual consumer's authorization, except for limited things like for treatment or payment or healthcare operations, okay? The other way that information could be protected from access in the research context is through certificates of confidentiality. So certificates of confidentiality used to be, they've been around for a really long time, and they've used to really kind of mean nothing. Because researchers could apply to the NIH and get a certificate of confidentiality, and basically what it said is, well, your institution could refuse to give over research information to law enforcement even if they had a warrant, but they don't have to, it's at their discretion. So the 21st Century Cures Act updated the law around certificates of confidentiality. Now you don't have to apply for them. They can be given out when you get research funding. And they're now obligatory. So law enforcement and other actors cannot access research information that is protected under a certificate of confidentiality, even if they have a warrant to do so or a subpoena to do so, okay? So that provides much heftier protection of research data. I will note that when you're dealing with direct-to-consumer genetic testing companies that are using their consumers' data for research purposes, they may also be using it for non-research purposes, and so the entire data set may not be protected by the certificate of confidentiality. It's only the research, the data that's collected as part of that research that has a certificate of confidentiality. It also only applies to research, and it only applies to certain federally funded research. So it's certainly not all-encompassing or all-protective. Okay, the other way to protect privacy is on the back end by preventing the discriminatory use of information once you collect it. So it's saying, well, you shouldn't collect it in the first place, but even if you have access to it, you can't use it in certain ways. So our best protection against this is our federal law, the Genetic Information Non-Discrimination Act, or GINA. It was passed in 2008. And what this basically says is that health insurers and employers cannot use genetic information, including family history information, for discriminatory purposes. Couple things to note about GINA. One is that it only applies to health insurers and employers, or certain employers over 50 that have over 50 employees. And so there's a lot of groups that it doesn't apply to, like life insurance, disability, long-term care. So it's been criticized pretty heavily for not being completely comprehensive in its protection. Also, there was really not a huge number of documented cases of discrimination that GINA was trying to address. It was really an interesting law because it was trying to address sort of this widespread concern about genetic discrimination or fear of genetic discrimination. And what's really interesting is we did, and this is not conclusive, but I think this is at least hypothesis generating, we did a national survey of people a couple of years ago, and it was about 1,500 people in the US, and we asked them if they had ever heard of GINA, and we compared that to if they had ever heard of other laws like HIPAA and ADA and things like that. Very few people had ever heard of GINA. And then we explained to them what GINA was, and we said what it did and what it didn't do in terms of providing protection. And the good news is that after we explained what GINA was, 30% of the people that we surveyed said that they were less concerned about their privacy. They felt more okay with their health, the security of their genetic information. The bad news is that 30% said they felt more concerned about their privacy after learning about GINA, because now they were like, oh my gosh, maybe I should worry about this, and it doesn't fully protect me, and maybe I should be more protected. So I think there's a double-edged sword there in terms of protecting against discriminatory use and how we address that from a regulatory perspective. Okay, so now I want to focus the rest of my time on this burgeoning issue of law enforcement access to consumer genomic information. So, I'm sure many of you recognize this individual. This is Joseph DAngelo. He was apprehended on August 24th, 2018, and he was charged with 8 counts of first-degree murder. And he was identified as being the suspect in the very infamous Golden State Killer cases, right? So the Golden State Killer was this very famous serial murderer and rapist who between the years of 1974 and 1986 had committed at least 13 murders, 50 rapes, and over 100 armed robberies across the entire state of California. And this individual was notoriously known as being not only a criminal and a rapist and a murderer, but like particularly evil in how he was committing his crimes. He really ravaged the entire state of California during that decade. People were terrified of this individual. And for 40 years, police officers tried to figure out who this man was. They had many, many, many sketches like the one up here on the right from people who had purportedly seen him at crime scenes. They had ample DNA samples that matched each other from the various crime scenes, so they knew that this was the same person. They had uploaded his DNA samples to the National Forensic Database CODIS to see if it matched with anybody in that database. The people in those databases are people who have been convicted of a crime or in some states have been arrested for a crime. It did not match anybody. So after 40 years, collecting thousands of DNA samples from people who they had gotten anonymous tips on because they had seen a sketch of this individual and said, oh, my neighbor seems kind of suspicious, maybe it's him, or my ex-boyfriend could be that person, or whatever. Following those leads, trying to find evidence around the crime scenes, they were unable to identify the suspect in this particular case. So a couple years ago, the FBI decided we were going to renew efforts to try to identify and apprehend the Golden State Killer. And they put out a big press release, and they said, we're going to offer a reward, and we're going to sort of reinvigorate our efforts to identify this particular criminal. And one of the FBI agents decided that they were going to try to use a new technology to do this. So what did they do? They took DNA from the crime scene, which they had, okay? They created a SNP profile of this DNA, and they uploaded it to a genetic genealogy database called GEDmatch. And the purpose of GEDmatch is for people to take their direct-to-consumer genetic testing information and connect themselves to other people that they might be genetically related to. So I want to find my long-lost relatives, and I want to know my inheritance. So I'm going to upload my information, and I can see anybody who's in the GEDmatch database, whether they're related to me and what the degree of relation is with me, right? So they said, okay, here's our crime scene DNA, that of John Smith. We're going to upload it to GEDmatch, and we want GEDmatch to tell us who's related to John Smith, right? And they found a third cousin of John Smith's, their suspect. So what did they do then? They went and they identified this individual who's supposedly a third cousin, and they did what law enforcement does. They did extensive investigative work. They created a massive family tree based on all kinds of public databases and Facebook pages and whatever they could get their hands on, right? They figured out who was in this person's family tree. They figured out if there had been any infidelity in the family. They did all their investigative stuff that they do, and they looked at all the third cousins that could possibly be on this family tree, and they honed in on this one individual who fit the profile. He was the right age, he was in the right place at the right time, he was an ex-police officer, so he wouldn't have been in the CODIS database. He looked a little bit like the sketch. So they followed him around. They waited for him to throw a tissue out in the trash. They picked up his tissue, took the DNA from his tissue, and matched it to the crime scene DNA, and it was a perfect match. So now they know they have their suspect, Joseph DAngelo, in the Golden State Killer case. Okay, so that's great, right? We've caught the Golden State Killer. This technique's now been used in probably almost 100 cases, I believe, and there's hundreds more that are in the pipeline of using this information. It has also been criticized by many people as being a horrible invasion of privacy and that it shouldn't be done. So I want to talk just for a minute about whose privacy we're worried about and talk a little bit about each of the players and their particular privacy rights in this space. So we could be worried about Sally's privacy, right? Sally's the customer. She has nothing to do with this crime. She does not even know that she has a third cousin who's Joseph DAngelo, right? So why should law enforcement be able to look at her DNA and be able to catch this criminal? That's the argument. So at the time when the Golden State Killer case was investigated, Sally might not have known that law enforcement was going to do this because there was nothing in the terms of service and nothing that indicated to her that her information would be used in this way. Since then, the companies have changed sort of how they practice. All of them that I know of now include in their terms of service whether or not they allow law enforcement to access the information of their customers. And different companies have different policies. So Ancestry and 23andMe will not give access to their customers' information without a warrant. GEDmatch, which was used in the Golden State Killer case, used to give access to all their customers unless you opted out. Now you have to opt into it. The consequence of that is that their database went from 1.4 million people that could be traced to now about 180,000. So that significantly not only impedes law enforcement's ability to do this, but it also creates a much bigger pool of people that they now have to investigate, right? So they can't hone in on the person as easily, so now they're looking at more people. And family tree DNA allows an opt-out for this currently. Okay, there's also, we could talk about it, I'm not going to go into it, but because I'm going to run out of time, but at the break, at the question time, we could talk about whether there's Fourth Amendment issues here, and people have argued that they don't really stick right now, but I think there's an argument there as well. Does DAngelo have any privacy interests in this? He's the suspect. I think most people would agree that when you leave your DNA discarded at a crime scene, that you give up your rights to privacy, and that's typically how we treat that information in law enforcement. The real concern is around all these other people that are between Sally and DAngelo, the suspect, who we've now investigated because they're somehow on this family tree. So very briefly, I just want to point out some of the issues related to their privacy. So what is law enforcement seeing? I think there's a misconception about what law enforcement is actually seeing, like, oh my God, law enforcement's seeing like all of these people's DNA. They're not actually seeing all these people's DNA. They're seeing who they match to and the number of centimorgans with which they match so that they know the relation to them. So it's a much limited amount of information that they're seeing. The second thing is they might be collecting information from these, they might be collecting information and DNA from these people in order to follow their investigative lead, but they're doing that anyways. I don't know if we all, I did not realize this. So this is 4 cases that were solved using investigative genetic genealogy. When they used that technique, the maximum number of people that they collected DNA from to investigate was 10. Before they used that technique in the same cases, the maximum number of people they collected DNA from investigated was over 600. So actually the social impact on our privacy might be smaller. So where do we go from here? This is like a brand new area, a brand new way of using consumer genetic information. We don't have regulations that really give us sort of a path forward in this regard. I think we made big strides last week. Several of you in the room were there, so thank you for participating. We organized a meeting at the Banbury Center where for the first time we brought together law enforcement, individuals from all of these companies, consumer advocates. You can see the list of individuals on the Banbury website. And I think the most important thing that came out of this meeting is we all left actually in conversation with each other about the appropriate path forward and how we ought to be doing this in the right way and what the major ethical issues are. So I just want to end by pointing out that when we're talking about privacy today, there's always risks to privacy. We cannot eliminate risks to privacy in the area of consumer genetic testing, healthcare testing, research testing, any of it. There's also counterbalancing values that are really important to take into consideration. So the use of information to advance research, improve health, and protect the public safety. And at some point, we all have to make trade-offs. And so I think that's what our conversation today really is about, is how do we make those trade-offs in a responsible and ethical manner. Thank you.